In today's lecture, I will look into the various other lesions of the central nervous system, especially the animal preparations like a decorticate animal, midbrain animal, decerebrate animal, decerebellate animal, and their characteristic features or various important features associated with them. Here in this diagram, I'm showing the 5 different levels of lesions in the nervous system, which I'm going to discuss in the next slide. This is the slide. What are the various animal preparations? If you are looking at the various animal preparations, I have listed here decorticate animal, midbrain animal, decerebrate animal, that is a hindbrain animal, decerebellate animal, and a spinal animal. And these are the various lesions indicating that the dotted line here is for the decortication, and the red line, this blue line is the midbrain animal, and then this red line is for the decerebrate animal, and the green line is for spinal animal. Decerebellate is not shown. Decerebellate is cutting up this level. Now, same thing I have shown here in this the brainstem map. You can just see that number 1 is above this thalamus, above the thalamus, that is the cortical, these things are decorticate. And this one you can just see here, this dotted lines. This is cerebral cortex. This dotted line cutting all the fibers coming from the entire cerebral cortex. That is a decorticate animal. That is how it sees. Okay, so then midbrain animal is above the superior colliculus. There are animal preparations wherein we want to keep the hypothalamus intact. So that means we have to go little higher up so that the hypothalamus remains intact. As here you can just see that angle. Then decerebrate animal is between the superior colliculus and inferior colliculus. This red line, this is a decerebrate animal, wherein this part of the brain stem, this part, that is the pons, the medulla, and the spinal cord are left to it. Decerebellate, I'm just cutting the 2 cerebellar peduncles, 3 peduncles here. So here you can just see on both sides, this is a decerebellate animal. And here below the level of the C4, it is the spinal animal. So these are the various animal preparations. Look into them again one more time. As I have mentioned, this is the section. Number 2, above the superior colliculus, that's a midbrain animal. Number 3, between the colliculi, that is the superior and inferior colliculi. Between this colliculi, that is the decerebrate preparation. Then decerebellate is the cutting of the cerebellar peduncles. That is the decerebellate preparation. The spinal animal is below this. Now, if you are looking at the sagittal section of the brain, how it looks like, you can just see that this dotted line, this indicates the decortication. It is a very extensive lesion, cutting the entire connections coming from the cerebral cortex. Rather, very massive procedure. That is almost you have to strip off the entire cortical layer. So that is the decorticate animal. Then this part, this is the midbrain. Above this midbrain, that is the superior colliculus, that is the midbrain animal. This part is the blue line here that makes the above the superior colliculus. That is the midbrain animal that corresponds here in this diagram. Then here it is the superior colliculus there and inferior colliculus here, and in between, sparing the part of the pons and the medulla, and some part of the midbrain, but not a full extent, very lower part. So this is the decerebrate animal. Then comes this violet line or a purple line is cutting the cerebellar contacts to the brain stem. So this is what I have shown here, and this is what is seen in sagittal sections. that is cerebellum. Somewhere here is the lower level. I am not, if I cut here, what happens? The diaphragm is also, diaphragmatic nerve supply is damaged. For that reason, I'm going down C4 below, that is the spinal animal. Looking at the same thing in another angle wherein you see this this is a sort of the coronal section. You just see the when you take the coronal section, this blue dotted line, you can just see that this is for the decortication. You can just see other one you saw the sagittal section. This is the coronal section, and you can just see that this entire area we have to destroy. That is the decortication. So one interesting thing about this entire area, all these cortical elements, most of these cortical elements, they funnel down through this internal capsule. This is internal capsule. This fiber is an internal capsule, or this fiber is an internal capsule. This is thalamus. This is caudate, and this is the globus pallidus and putamen. So that means this part is the internal capsule. Suppose if we cut this internal capsule here, so this entire part, if you are destroying this thing, it is as good as cutting that means both the sides, if you cut, that may also produce the decorticate preparation. Then above the superior colliculus, that is the midbrain animal. So that means only midbrain is intact. And between the colliculi, here it is between the colliculi, it is the decerebrate animal. And below the spinal cord, it is the spinal animal. And here is the cerebellum, cerebellar peduncles. You can just see these peduncles coming out here, and these things we have to destroy. That is the decerebellate animal. Okay, why I am trying to impress upon you with the different pictures, so that you will have the visibility or imagination for the terms we are trying to use. Now, before we go into the different aspects about these lesions, we should know what are the things we should look into. In a normal individual, we have the higher functions intact. Is the normal higher functions. I can behave socially, I can know the time, space, and all other higher functional aspects. My intellectual, my interactions, my presence of mind, everything, they are intact. This is a higher function. They are normal, and this is processed in the prefrontal cortex, especially the neocortex, and some part of the hippocampus and the limbic system. This is cerebral cortex intact. So this is the level of integration. Then in a normal individual, we can establish the condition reflexes. We have already certain condition reflexes which are well established. That is the smell of a food produces salivation, or a timing of the particular thing in the afternoon, somewhere around 12 o'clock or so, you feel hungry, and that is the conditioned component. So these condition reflexes are requiring presence of a cerebral cortex, because they have to require, because the sensations coming up. So you can just go with the Pavlovian characteristics. In the Pavlovian characteristics, what is that? Ringing of the bell and producing the salivation. So ringing of the bell means the auditory cortex should be intact. From the auditory cortex, it goes to the association areas, and from the association areas, it comes back to the parasympathetic system that drives the secretomotor function of the salivary glands. That is the Pavlovian model. So then emotional reflexes, again, this requires the cingulate cortex and the limbic system and hypothalamus. Cingulate cortex, limbic system, and hypothalamus. We react to these things. We become happy, we become angry, we become depressed, we become jovial, and whatnot. We react all that. They are in a normal individuals. They are there. They exist. Then the locomotor reflexes, like walking and even talking, these are all a pattern of activities. these locomotor activities and the speech and the speech activity, they are all governed, especially the locomotor activity, are governed by the centers in the thalamus and the midbrain. Then we have the writing reflexes, that is orientation of our head in space in relation to body, so that these reflexes are settled in the midbrain. The anti-gravity reflexes, they are with the otolith organs and the limbic components, or body or proprioceptive components, and with the cerebellum, they are processed in the medulla. The respiration, it is the pontomedullary component that is in the medulla. The spinal reflexes are only concentrated in the spinal level. So that means this side tells where the centers are located and what are those preparations. In a normal individuals, all are plus, all are present. Now, decorticate preparation, I have already given a number of slides showing the different levels. In this decorticate preparations, what is happening, this entire part is stripped up in an animal. This is entire thing is stripped up in an animal. And if you are looking at the man, this entire part is removed. So this can happen in case of a global ischemia. Global cerebral ischemia, in that case, these neurons will be dying, and this entire part may be cerebral cortex may die, or the anoxia, or another thing I said, the internal capsule lesion, in which the incoming fibers are cut or disassociated from the cerebral cortex to the down. So that is the three components I have just mentioned here. Global cerebral anoxia, ischemia, global cerebral ischemia, or internal capsule lesions, they all produce this decorticate preparation in man. In animals, it is a stripping of the entire cortical mantle. So this is the decorticate. You can see this dotted line and the arrow here. Now, what happens in this decorticate preparation? The higher functions, because you don't have the frontal cortex, because the entire cortex you have removed. You don't have those the centers which govern these higher functions. So then higher functions are absent here in this decorticate animal. The conditioned reflexes, usually they are absent because they are processed in the cerebral cortex. That is why they are, I have made it the minus plus, because this is how it is being described in the Ganong. But I don't expect this thing. I have put a question mark. I will also put 0, because ringing of the bell to be heard in the cerebral cortex. And if the cerebral cortex or a smell of a food, it has to be reaching to the cerebral cortex. If that is not there, so then reflexes are not there. So conditioned reflexes are absent. The emotional responses, what happens, the prefrontal cortex or the neocortex always suppresses certain amount of our emotions. So usually what happens in a given circumstances, we are not laughing, or we are not crying, or we are not becoming very expressive, or we are not becoming aggressive. All these are suppressed by the neocortex. And in the absence of the cortex, so these hypothalamic component become, or what is called the limbic system and some part of the hypothalamus, they are not suppressed. So that means they are exaggerated. There will be exaggerated emotional responses. A person may start being angry. It's a sham rage effect, or he may become placid, or he start laughing, and so on and so forth. So this is it. Another part, they are similarly, the cerebral cortex suppresses the locomotor reflexes present in the thalamus and midbrain, and they are not suppressed now, they will be exaggerated. The writing reflexes, they remain as they are, or they may be slightly over responsive. That means the writing reflexes are either normal or over responses because they are in the midbrain. They are, but one thing is certain here: the visual writing reflexes are absent because the visual writing reflex requires the occipital cortex. So all other writing reflexes, that is the vestibular writing reflex, body on body, body on head, limb on body, all reflexes are intact, and these intact reflexes are operative, excepting the visual writing reflex. Please note that. The anti-gravity reflexes, yes, they are exaggerated. They are exaggerated. Here in decorticate preparation, the lower limb extension, upper limb flexion. Upper limb becomes flexed and the lower limbs extend. I would show that. And this is because this anti-gravity effect, because the red nucleus is intact. The red nucleus exerts the flex action on the flexor group of muscles. That is why in the upper limb, and the upper limbs become flexed. I would show that. The respiratory reflexes are unaffected because they are not monitored, because they are mainly monitored by the regulatory mechanisms arising either chemical or neural components regulating respiration. Then in the spinal reflexes, there are two important things. One, the tone. Tone is a reflex activity, and there is a hypertonia, what is called a spasticity. Spasticity is that it is initially there is some amount of resistance, and if you try to bend it, it will yield. That is this spasticity. And the deep tendon reflexes are exaggerated because these are spinal reflexes. They are not, now usually they are suppressed during normal situations, and they become liberated, or they become exaggerated. That is about the decorticate preparation. This is the decorticate posturing. You can just see that what I mentioned here, the lower limb extension, upper limb flexion. You come back here, this lower limb is extended. You can just see that extension. You can just see that feet and legs extended out, and you can just see this information. And this upper limbs, they are flexed. You can just see that flexion, something like this, and the extension of the limbs, and even the neck may have some amount of opisthotronous position. That means backward, the dorsal extension there. Okay, so now decorticate preparation, again I repeat, it is a mental stripped up in animals. In man, anoxic encephalopathy after anesthesia or cardiac arrest, because what happens in case of the sometimes the cardiac arrest, there is a no blood supply, and that no blood supply to the cerebral cortex may kill, or it can be produced by the intercapsular lesions. Spasticity is present in decorticate rigidity. Spasticity is a hypertonia type of rigidity. It is a spastic rigidity. So this is differentiated from the rigidity of the basal ganglia, where both agonist and antagonist group of muscles are overactive. Extension of the lower extremities and the flexion of the upper extremities. So this is sort of a double hemiplegic posture, and this is due to the red nucleus, because the red nucleus remains intact. Deep tendon reflexes are exaggerated. This is what happens, and if you can see this preparation here, this part is out. This is out. This segment is out. So the inhibition over this basal ganglia and the red nucleus is not there, and this is the red nucleus. And in humans, decortication removes inhibitory control of cortex on two. This is the two, the basal ganglia, red nucleus, or the midbrain activity, resulting in increased rubrospinal and pontoreticular output. So rubrospinal, this is rubrospinal and pontoreticular output. Now, so again, looking into this diagram, you can just see that what happens in case of the decortication. In case of the decortication, this one, this D is the decortication. In this, this is a corticopontine. The corticopontine fibers, they are cut. They are cut. These are excitatory to this pontine reticular system, which are facilitatory or excitatory reticular system to the gamma motor neurons of the extensor group of muscles. Now, this corticopontine are not, they are suppressed. That means excitatory effect is suppressed. At the same time, this corticopontine receives excitatory inputs from the ascending lateral interlateral column sensations, that is why they would be more excited. There would be more gamma motor neuron activity. This is a gamma motor neuron activity. Now, what happens? That corticobulbar or corticomedullary fibers, they are also suppressed. These medullary fibers are carrying the inhibitory inputs to the gamma motor neurons. If you are looking at this is because this is being active, this is double activated, this is single activated, this is taking upper situation, the upper hand. This takes the upper hand. The balance is 2 plus, and that means this plus and this plus is lost. 1 plus still remains. That means it is excitatory. So this plus is for a minus. This is also no minus here, and this is not balanced, and it is exaggerated, increased gamma motor neuron activity. Now come back here. It is a corticospinal tract. Corticospine. This is a flexor group of muscles. The corticospinal tract gives it to the flexor muscles here, and a rubrospinal tract. Corticorubral fibers. Corticorubral fibers are there is no excitatory input to the rubrospinal fibers, and the rubrospinal fibers receives input from the interpositus, the cerebellum. So that means interpositus or pontorubral fibers, cerebello-pontorubral fibers. They are excitatory in these things. The excitatory of these things, these drive the rubrospinal tract, and they are on the flexor group. That is why you say that upper limb there is a flexion in case of the decortication. So if you are looking at this decerebration, this is not there. Red nucleus is not working. Okay, so that means the upper limbs are in a flexed state. Now come back here. What happens? These vestigial nucleus and other the cerebellar inputs to the vestibular nuclei are not hampered. Overall, intrafusal fiber activity in turn increases the muscle tone. Increased muscle tone, increased deep tendon reflexes, the flexor, upper limb flexor activity. These are the classic pictures of the decortication. That's what I have mentioned here. Removes cortical influences on corticospinal and bulbospinal and excitatory and inhibitory part, gamma motor neurons. Rubrospinal output from cerebellar inputs persist, which control the upper limb. Okay, so now this is what the decorticate. You can just see that this is the intercapsular lesion here, and in this intercapsular lesion, you can see that a decorticate preparation. The upper limbs flexed, the lower limb extend. There is some amount of dorsiflexion of the neck or the opisthetonous position. This is a decorticate preparation in comparison to decerebrate preparation, wherein the upper limbs also extend. This is extend, upper limbs also extend. Because this extension of the upper limb here, because the red nucleus is not giving the influences, here red nucleus intact, red nucleus not intact. So that is the decorticate and decerebrate preparation. So then we move on to the next level, that is the midbrain preparation. So it is above the superior colliculus. So this is superior colliculus here, and the lesion is above the superior colliculus. When the lesion is made above the superior colliculus, the midbrain remains intact. But all the thalamus, the basal ganglia, and the cortical inputs are not reaching down. And this is the midbrain, and the lower parts are intact. That is midbrain preparation. That can be performed because the lesion is above the superior colliculus. Now here you can just see that. So if this is what about the superior colliculus. This is the lesion wherein you have this suppressor activity of the cerebral cortex and the suppressor activity of the basal ganglia, red nucleus, the regions, whatever the activity from the cortex and the basal ganglia and red nucleus are not reaching. So now you have this facilitatory pontine reticular system, the inhibitory medullary reticular system, and you have the cerebellar system. You can have, this is a vestibular system. Now what happens? So the lesion above superior colliculus, red nucleus, subthalamic nucleus, and hypothalamic are remain intact. Lesion above the superior colliculus, these things remain. But if the hypothalamus has to be involved, again it should go little higher up. So now, red nucleus and the subthalamic nucleus, they remain intact. So for that reason, what you will see the influences, supracollicular lesions, the midbrain preserved. The inhibitory control of 192 are lost. The inhibitory control of 192 are lost over this. And second, inhibitory control of one on the medullary reticular system is lost. This inhibitory reticular system is lost. Okay, that is inhibitory to 2 and 4 areas. 2 and 4 areas are inhibitory. The effect of 2 is inhibitory over facilitatory reticular system and the facilitatory reticular system in the 5. This is what we have shown. Now coming back, the brainstem is again I repeat, in the midbrain preparation, brainstem is transected above the superior colliculus. This is known as a Cerebral isolate preparation, and this preparation is used to study the EEG features in this, especially the reticle, because it's the mesencephalic and the pontomedullary reticular system. They synchronize the EEG pattern, that is the brain move. What is that synchronization? Synchronization is what? Changing fast irregular waves to slow regular waves, as happens in case of sleep. The synchronization is a changing of fast waves to slow waves, because as we go into deep sleep, the waves become slow and slow. This is synchronized. So now when you cut the midbrain preparation, these are not synchronized, they are desynchronized. That means, so there is no following, they are all having a fast. That means there is no slowing of the waves in case of the EEG. I've already mentioned the red nucleus, subthalamic nucleus, and posterior part of the hypothalamus are intact in this preparation. So in addition, in these preparations, there is unconscious proprioceptive reflexes. They persist. Writing reflexes remain or persist. The cats can stand and walk. Of course, the walking may not be as precise because they don't have the visual inputs, but they can walk blindly. But this is not possible in monkeys. We don't know about that. Maybe some of those, whatever the locomotor reflexes are lost here in this particular preparation. Now I have put this table here. It's a decorticate. Already I explained what happens in the midbrain animal. Higher functions are lost because cerebral cortex is out of question, out of condition. Reflexes cannot be established because they require the cerebral cortex. Emotions are not there because hypothalamus is missing. The locomotor activity is exaggerated because partly exaggerated. Writing reflexes are exaggerated here in the midbrain preparation because they are more enhanced, or in the sense more overactive. The anti-gravity reflexes may be remain present, or they may be over-responsive. Respiration is normal. Spinal reflexes, you have the increased muscle tone and increased deep tendon reflexes in the midbrain preparation. Okay, we move on to the next preparation, decerebrate. Yesterday, I mentioned a lot about these things. I will just go through, or I just revise the only the mid-collicular, the classical Serringtonian decerebration. This is a red line here, number 3. This is superior colliculus. This is inferior colliculus. In between, if you cut, that is the mid-collicular lesion. That is decerebrate preparation. Here it is decerebrate preparation. Here in this animal, what is happening? This entire thing above this is lost, and below this thing, this hindbrain remains. That is the pons, medulla, and the cerebellum. They remain, and this is known as a hindbrain animal. Okay, so now we move on here. This is a typical decerebrate cat. The limbs become hyperextended, as you see here in this situation. All the 4 limbs become hyperextended. Tail and head dorsiflexed. See, the tail is coming like this and making a typical C-like structure. And the back concave. This is concave, and extreme hyperextension of the spine. Hyperextension of the spine. That's called a opistheotonous position. So the normally spine is like this. Now it becomes like this. The caricature of standing, because they cannot stand by themselves. The writing reflexes are lost. It has a very peculiar caricature standing, and you can just place it on the table or on the ground as if like an inanimate object. So that means it is the cat after cutting the mid-collicular section and removing the anesthetic effect. So once it comes out of the anesthetic effect, this is the feature of this decerebrate cat. And decerebrate rigidity present are the in all the 4 limbs, especially in the anti-gravity muscle. The anti-gravity muscles have a rigidity in all the 4 limbs. Deep tendon reflexes are exaggerated. Muscle tone is increased in these animals. So this is a decerebrate cat. Now, looking at this diagram I take back here, and this part A is the decerebration. I just explain again. In this thing, what is happening? There is a loss of input from the corticospinal. This is corticospinal, and rubrospinal. This is rubrospinal, and the mesenchymo reticular writing reflexes, because the writing reflexes are coming from here, they are also absent. However, the pontine, this pontine reticulospinal or excitatory reticulospinal tract is intact on the extensor group of muscles. This is pontine, this is intact, and the medullary is intact, but these are not balanced because of the inputs from the excitatory inputs from the ascending anterolateral column sensations. The anti-gravity muscles and extensors are not inhibited. So these gamma motor neurons of the extensor are not inhibited, and this would enhance the activity of the muscle spindle, and that would enhance the activity of the extensor muscle. And this was shown by the experiments. By cutting this nerve, this abolishes this, or by injecting local anesthetic here in this, it abolishes, or by giving chlorpromazine, that means that phenothiazine, so that suppresses the gamma motor neuron activity. This is the gamma motor neuron activity that decreases. Okay, so now that decreases the 1A alpha activity because through the muscle spindle. In addition, the corticospinal tract are lost, so there is no voluntary control. So then rubrospinal tract are lost, because the rubrospinal tract controls the upper limb flexors. These are the flexor group of muscles. Upper limb flexors are lost, so that is why you have all 4 limbs extended. Because in the decorticate preparations, this was intact, so now they are lost. So you have the increased extension of all 4 limbs. In addition, what is happening, the inputs, the cerebellar inputs, the interposito, these things are lost. So now that is again, it's not, it is having a 2 plus here. Now this 2 plus means there is only the diminished rubrospinal inputs. So that would decrease the activity in the upper limb, so that the gamma motor neuron of the extensors takes over, and this in turn, in the less activity here, in turn they have a reciprocal interaction. This would be uninhibited, and there would be more extensor activity there on second count. So these are the effects of decerebration, which I have explained here. The pontine reticular system excitatory is intact. The medullary reticular system is also intact. Anti-gravity muscles are not inhibited, extensor overactivity. Now, this is a decerebrate. You can just see that the decerebration is here. So in case of here, the decerebration is the mid-collicular. So this part is lost. All the inputs coming from the entire cerebral cortex, thalamus, and red nucleus to the brain stem are lost. And then this is decerebration. You have the hyperextension of both the limbs, dorsiflexion, opisthetonous position, increased muscle spasticity or rigidity, and then that means gamma motor, because of the gamma motor neuron activity, and there is an increased muscle tone. This is what the decerebrate, and this is because of the red nucleus is not functioning. All other gamma motor neuron activities are uninhibited. So now this is a decorticate because the red nucleus is present, these flexors. This is what is happening. So both the conditions, the deep tendon reflexes are exaggerated, the muscle tone is increased, the lower extremities extension, but only difference is the upper extremity here, the flexed here and extended here. Extended in the decerebrate preparation, flexed in the decorticate preparation. Now, considering the table here, the decerebration, you have higher functions absent, the conditioned reflex is absent, no emotions, no locomotor activity, no writing reflexes. The animal cannot stand by itself. It cannot orient the head. However, the anti-gravity reflexes remain present, respiration present, and the anti-gravity reflexes are exaggerated because of the greater extensor or the anti-gravity muscle activity, and the spinal reflexes, muscle tone, and the deep tendon reflexes are exaggerated. This is a decerebrate preparation. Now, we have the causes of decerebrate rigidity. I have already explained. I read it again one more time. It is due to the loss of inhibition from the cortex, red nuclei, and basal ganglia over pontine facilitatory reticulospinal tract on gamma motor neurons of the extensor group of muscles. Then the medullary reticular inhibitory system becomes non-functional. So that means there is no inhibitor activity. Loss of inhibitor activity, the enhancement of these things, it's a double effect. The absence of corticospinal and rubrospinal inputs to flexor motor neurons, in turn, reciprocal inhibition over extensor is absent. So you can just see that. So that differentiates it from the decorticate preparation. The vestibulospinal inputs are also unchecked, so that will sensitize the alpha motor neuron. These are all the 4 causes of the decerebrate rigidity. The first thing is increased gamma motor neuron activity from the pontine facilitated reticulospinal tract, and the non-functional or the no inputs to the inhibitor reticular activity is another thing which adds to this gamma motor neuron activity. And we have the absence of the corticospinal, rubrospinal inputs, the flexor muscles, in turn reciprocally reciprocal inhibition of the on the extensor is absent. That again makes the facilitation and the vestibular facilitation. These are the causes of the decerebrate rigidity. What are the differences between the decorticate and the decerebrate rigidity or posture? Decorticate preparations. I will just take overall, not only posture, decorticate, the differences between the decorticate and the decerebrate preparations. Here I have listed one level of lesion is at the internal capsule or the entire cortical mantle. Here it is the intercollicular or mid-collicular. Parts spared, all parts except cortex are functional in case of decorticate. In decerebrate, hindbrain is only functional. The posture, the upper limb flexed, the lower limb extended. Here in decerebrate preparation, it is both the limbs are hyperextended. And even the neck in both the situations is dorsiflexed and opisthotonous position. The motor neurons, here there is an increased gamma motor neuron activity. There is an increased gamma motor neuron activity. In decerebrate preparation, the increased gamma motor neuron activity is more than the decorticate preparation. Because in the decorticate preparations, there would be red nucleus and other the basal ganglia inputs reaching to the pontopeduncular nucleus, or they are still suppressing. The conditions, this is resulting from the global cerebral ischemia, anoxia, or the internal capsule lesion. In case of a decerebrate preparation, it is because of the uncal herniation, because of the space-occupying cerebral tumors or cerebral abscess, or the raised intracranial pressure, or whatever, which throws out the part of the brain through the herniation. That is because of the space-occupying lesions. The compatibility with life, here in the decorticate preparations, the person may survive, of course, they survive with a deficiency. And the decerebrate preparations in man are fatal. That is why you may not get these patients. They may die even before they reach the hospital. Now, other aspects, what are the condition reflexes are absent here in decorticate condition. I am using, though I have written plus minus, because some books mention that, but for me, it is not reasonable to say that they present, they are absent. They are absent here. Emotional reflexes are exaggerated, here absent. Emotional reflexes are coming from the hypothalamus, some part of the limbic system, which are still remain spared, and they are not suppressed by the neocortical inputs. So that means they get exaggerated. The locomotor reflexes, similarly, the medullary locomotor actions are not inhibited, they are exaggerated, they are absent here. The writing reflexes, excepting the optic or visual writing reflexes, all remain intact, all remains present. Here, all the writing reflexes in decerebrate preparations are lost. The anti-gravity muscle reflexes are exaggerated in decorticate preparations. And in case of decerebrate preparations, they are exaggerated, but they are exaggerated more than the decorticate preparations. For that reason, I have given 3+ here in a decerebrate condition and a 2+ here for a decorticate condition. The stretch reflexes are exaggerated in decorticate preparation, and they are exaggerated in decerebrate, but here 3+ and here 2+. The tone is increased, 2+, tone is 3+. This tone, hypertonia, is known as the spasticity. It is different from the rigidity seen in the basal ganglia lesions, where both the agonist and antagonist group of muscles are seen. These are the differences between the decorticate and decerebrate preparation. You just look at this thing: level of lesion, the parts spared, the posture, the motor neurons, the conditions, compatibility with life, and other reflexes. You can just see the conditioned reflexes, emotion reflexes, locomotor reflexes, writing reflexes, anti-gravity reflexes, and stretch reflexes. You just remember all these things and you write, you try to rehearse this table that would make you thorough with the decorticate and decerebrate preparations. Now, about the decerebellate preparation. So in this, what I have made this L type of red thing. This is a decerebellate. That means I'm removing the connections, because the cerebellum is connected to the brain stem by 3 peduncles. So these are all these 3 peduncles are severed, and the cerebellum is totally cut off from the brain stem or connections to the brain. So then what happens? So this is what the circle I am showing here. The cerebellum has 3 levels of connections. One level from the dentate nucleus, dentatothalamic contacts, which is not shown here. The dentatothalamic contact, so that is again coming here. That is going to the cerebral cortex. That is necessary for the programming and the planning of the motor actions. Then interpositus, these are the correction, these things. Interpositus nucleus, that is the spinal that would be interacting with the red nucleus and other thalamocortical inputs, the red nucleus and the thalamus. So dentatothalamic is to the thalamus. This is interpositus is to the red nucleus and other nuclei in the mesenchyma, where they will maintain the posture and the locomotion. In addition, they will also give to these olivary nucleus and also these reticular nucleus and also to the vestibular nucleus. Then we have these vestigial and the nucleus and the from the flocculonodular lobe. They are inhibitory to the vestibular nucleus. This is vestibular nucleus here to the alpha motor neurons. So these are the various aspects. When you remove thalamus, these are lost. When they are lost, what happens? One thing I would like to say that the person does not die. It's not a fatal thing. But without cerebellum, the quality of life and the quality of motor activity suffers great. So it is a compromised motor activity. So now these are the various aspects in the decerebellate. When we remove the cerebellum, so it is not fatal. The person survives, but his quality of the motor activity is tremendously affected. He may not be able to stand. He may not be able to walk. He may not be able to do any activity. He may not be able to balance, so on and so forth. So now here, if I look into this table, what happens if you just see that the decerebellate animal, higher functions are intact because the cerebrum is wonderful. It's working. Cerebral cortex is intact. It is normal. The conditioned reflex is normal. But the conditioned reflexes which may require the motor actions, motor actions do happen. Those motor actions would be compromised because there is a ataxia or incoordination or other symptoms of the motor activity. Then emotional, okay, they are not inhibited, but the emotional expressions or the motor actions, they may not be as vivid as we say with the normal individuals. But the emotional reactions are there. If you see emotional reactions in terms of the blood pressure, respiration, and other things, they will be exhibited very well. Now come back here. The locomotor part is incoordinated. So the locomotor responses are incoordinated. The corrections are not proper. The writing reflexes are incoordinated because the orientation of the head and body in space. The anti-gravity muscles are incoordinated. Respiration remains okay. Then what we see in the spinal reflexes, there is a atonia and a pendular deep tendon reflexes. What is this pendular deep tendon reflexes? When you hit the patellar tendon, there are oscillations of the quadriceps muscle contractions and the lower limb, and these usually we will have a 2 to 3 oscillations, not more. But in case of the cerebellar lesions, the corrections are not happening. These oscillations go on more than 4. This is called a pendular reflex. As if this becomes a pendular or like a pendulum. So this is what the decerebellate animal. In case of a spinal animal, what happens? It is the spinal cord is cut. The remaining parts, maybe once I happen to see in Ganong, these are all 0, 0. If these are all 0, 0, everything is 0. So now what happens if something, the cervical level, if there is a lesion, everything he will be able to express. He's conscious, he sees what is happening to him, and everything is intact. All things are normal. That is why I have not mentioned anything. Here, only thing, the spinal reflex is at the level of the lesion and below the level of the lesion. At the level of the lesion, they are lower motor neuron type of activity, and below the level of the lesion, it is upper motor neuron type. There is a increased tone and increased deep reflexes. That is about the spinal animal. Now, coming back again, I'm revising or summarizing whatever the things in a different table format. So the animal, the decorticate animal, what is the level of lesion here in this decorticate level, decorticate animal? It is the removal of the cerebral cortex or global ischemia or internal capsule lesion in case of human being. What happened to segmental reflexes? These are segmental reflexes are originating in the spinal cord. They are tone and the deep tendon reflexes. Both are exaggerated in decorticated. Okay, in case of the tonic labyrinthine reflexes, they become exaggerated because they are not suppressed, the labyrinthine reflexes. The writing reflexes, they remain, excepting the visual writing reflex or optic writing reflexes, they are exaggerated. In case of the optic writing reflex, placing and hopping reactions, they are absent because they are operated at the cortical level. The optic writing reflex and the hopping and placing reactions, they are absent. Then comes the second preparation. I did not talk about the thalamic animal. I will just say that the lesion is above the thalamus. It's cut above the thalamus, so that thalamus is intact. If thalamus is intact, especially this part is utilized for understanding the pain and some part of the EEG pattern. I will describe them when I take up the sleep. But what happens is in this thalamus animal, if the level is above the thalamus, only this cortex is removed. In this case, tone is exaggerated, the deep tendon reflexes are exaggerated, and you have the same thing as that of the tonic labyrinthine reflexes and neck reflexes, and the writing reflexes are exaggerated. Again, you see that the optic writing reflexes, placing and hopping reactions, the emotions, the conditioned reflexes, all are absent here. The midbrain preparations above the superior colliculus, you have the exaggerated responses here, exaggerated segmental muscle tone, and exaggerated deep tendon reflexes, exaggerated tonic neck and labyrinthine reflexes in midbrain animal, and exaggerated or enhanced writing reflexes in this midbrain animal. Again, the absent optic writing and writing reflexes, and placing and hopping reactions. Because the midbrain is the center for writing reflexes, excepting the optic writing reflex. So in the midbrain animal, that means midbrain is intact. So the writing reflex is present. However, the locomotor reflexes may be absent, may not be as clean as before. Now, hopping and placing and hopping reactions may not be because they require the cerebral cortex. In decerebrate animal, what happens? It is the mid-collicular sectioning or uncal herniation in case of the human beings. What you get the increased 3+ tone, hypertonia, increased tone. In case of decerebrate, increased 3+ tendon reflexes. I have made only 2. Please correct me. It is 3+. That means to indicate from the difference from the rest of these things. A greater greater activity of the deep tendon reflexes, tonic labyrinthine reflexes are intact because they may be more exaggerated because they are not suppressed by the midbrain and the midbrain inhibitory activity and the cortical suppressor activity. So, however, the writing reflexes are absent because the midbrain is not connected. Writing reflexes are absent, and the optic writing reflexes, placing reactions, hopping reactions, the emotional responses, locomotor activity, everything is absent in decerebrate animal. They cannot write, but they can be held. They can be held in position just placing. Now, below the spinal animal, below C4, you may get exaggerated or depends upon two things, at the level of the lesion, below the level of the lesion. If we are looking at the below the level, at the level of the lesions, this is a lower motor neuron lesion. So all things are absent. Below the level of the lesion, if you are looking at, so this is a little bit, muscle tone is slightly increased, or it is only happens after the spinal shock. Then in case of the deep tendon reflexes, they become slightly brisk or exaggerated. I did not place 2+ there, but they will be brisk, or there will be little more than normal. And remaining things, tonic labyrinthine and the neck reflexes are absent, the writing reflexes are absent, and the optic writing reflex, placing hopping reactions, emotional reaction, everything is absent here in this spinal animal. One important part, see what happens in case of the so this becomes a contradictory situation, because the optic writing reflex may be the head position, the trigeminal nerve, the oculomotor nerve, so they are intact, and cranial nerve, other cranial nerve, the accessory muscles which are placing the neck, they may remain intact and they may be operated because it is level below the C4. So now I would use with a caution here some of those neck reflexes may, because they try to orient place the neck and head relation, they may be present. So that is about the spinal animal. In the spinal animal, there are a lot of conflicts and controversies here because of the cranial nerves or cranial nerves supplying the muscles are intact. They will try to govern certain features of the head and the neck muscles. Okay, now coming back, today's assignments, describe the effects of lesions in the Neuraxis at various levels. So I would advise you to briefly describe the table and briefly describe the differences in the features of the decorticate and decerebrate animals. So that means you put the table, and then you put the table of the decorticate and decerebrate animals, and if you practice that, and you are through with this particular chapter. Write short notes on decorticate preparation, decerebrate preparation, causes of decerebrate rigidity, midbrain preparation, decerebellectomy. Okay, so these are the assignments, and the reference books. Mainly I have taken it from a Candle and the Samson Wright. Very difficult that some of them are not clean here in the Guyton's and Ganong's textbook of physiology. Okay, then what we do in the next class, we will discuss about the skeletal muscle tone and factors regulating the muscle tone. Also, we will try to differentiate between the spasticity and rigidity in the next class. Okay, thank you.